Hi, I'm Sarah Bernstein. I'm a clinical nurse specialist in gynecologic oncology, and I'm here to talk to you about some issues that might be coming up when you're receiving your chemotherapy. And today we're going to talk about fatigue. So what exactly is fatigue? Well, it means you're really feeling tired, not only physically, but mentally and emotionally. You have less energy to do the things that you normally want to do, even though you really want to do it. In people with cancer, it can be caused by the cancer itself. It can be done by the treatment, chemotherapy, surgery, getting ready for all the tests. All these things can make a big impact. And fatigue can last a long time and affect your mood, your employment, your daily routines, how you take care of yourself, how you go play and have some fun, your relationships, and also your sense of self. Risk factors include things like poor nutrition, immobility, not being able to sleep, stress, low red cell count or anemia, hypoxia, if you have an infection or a fever, certainly if you have pain or you're taking pain medications, and then your treatment things such as surgery, chemotherapy, and radiation. Those can all increase your fatigue. And do you have sleep apnea? And if that's not treated well, then you're not sleeping well. So what can I do to improve my ability to feel less fatigued? Well, believe it or not, it's like that Nike commercial, a body at rest stays at rest. It's really important you get a little bit of exercise every single day. That doesn't mean just walking around the house. It means you actually need to get outside, put on your sneakers, and take a walk around the block as best you can. There's a lot of research that shows that 10 to 15 minutes of exercise every day can change and make an impact on all the symptoms that we're going to talk about today. But we need to balance exercise with rest and being able to use your energy for the things that you really want to do. So also look for other reasons. One of the reasons, the number one reason for fatigue is dehydration. So are you getting enough fluids? Water by itself is great, but not everybody can drink a lot of water. And some of the chemotherapies that we use can make water not taste so great. So try some other things like smart water or throwing some lemon or lime in the fluids. Iced tea, mix it up. Basically, I'd like to see that you can void every hour. Then you'll know that you're really getting a lot of fluids in, but it's important that you get enough fluids to wash everything out. One of the best things you can do is to try to drink a glass of water first thing in the morning before you even have coffee. Low red cell count or anemia can make you feel very tired. Other electrolyte imbalances, they can also make you tired. Are you getting enough oxygen? So if we have issues in the chest, those things can make it harder to breathe. Sometimes adding a little oxygen at home can make you feel better. And of course, are you getting enough sleep, or when you go to bed, are you sleeping? So it's important that during the day, if you take a nap, understand that sometimes you won't sleep so well at night. So if we can kind of push things out, so I know you don't feel well, it's important that you still try to get a little bit of a walk, even if it's going to the mall, and then try to sleep all night. Is sleep apnea, again, a concern? Is that something that you've ever been checked for? And then if you can keep kind of an activity and a fatigue journal to bring to your physician's office and talk to them about, this is why, when I feel tired. Usually patients will tell me they feel best first thing in the morning, and then as the day progresses, then they notice that they get that big tired feeling. Sometimes putting your feet up around 4 o'clock for at least 10 or 15 minutes can kind of rejuvenate you for the evening. Okay, that's all I have for you today on fatigue. If you have any concerns or questions, or this just raises a lot of thoughts for you, then please bring them to your oncology nurse or your physician to talk about and see if we can help you to feel better.